Chapter 2. Pigmented Lesions. Prior to treating pigmented lesions, be certain that they have been thoroughly evaluated and are certain to be benign. Remember to follow the guidelines for initial consultation, skin care, and safety as reviewed earlier in the video. Superficial pigmented lesions can be treated with the Gentle Max Pro using the 755 nanometer wavelength, which has a strong affinity for melanin. You can use a variety of spot sizes, depending upon the size of the lesions. You may cover the surrounding tissue in order to protect it, or you may choose to use a painting technique in the case of a large number of lesions in skin types 1 to 3. In this case, we have chosen a spot size of 8 millimeters. Consult the treatment guidelines for the guided user interface for options regarding spot sizes and energies. Pulse the laser and wait 2 to 3 minutes to evaluate the response. You will see a light frosting and then subsequent darkening of the lesion. This is the ideal treatment response. It is also acceptable to see only a darkening of the lesion. The response will depend upon the amount of pigment in the lesion. For dense and deeply pigmented lesions, less energy will be required, and the response will be more robust. For lighter lesions, more energy may be required. When using the painting technique, first be certain to test a small area in order to check the response of the skin and the lesions before proceeding. If there is no adverse response to the non-pigmented skin, the treatment can proceed. After the treatment, it is important to keep the area well hydrated and protected with sunblock. The lesions will crust and eventually exfoliate. As the skin in the area regenerates, it should be hydrated and protected. The treatment can be repeated in 4 to 6 weeks.